Okay, good afternoon, everyone. This is Tracy Plauk. I'm the director of the Ohio Department of Mental Health and Addiction Services, and I'm pleased that folks are able to join us today. So far, we have about 21 people participating, which is about half of what we have registered. So we may have additional individuals joining us. We wanted to reach out to the statewide associations and some of our key sister agencies to discuss the Cures Act, 21st Century Cures Act grant opportunity that we have. And so what we wanted to do today is just basically provide a summary of the parameters of this funding opportunity, discuss how we are planning to target Ohio's application, how you can be helpful to us in that regard, and next steps. And then I will take questions. For the questions component, we'd like you to type the questions in the chat box, which I guess you could do at any point during this presentation, but we will manage those at the end. So I wanted to talk just a little bit about the grant itself. It is officially the State Targeted Response to the Opioid Crisis Grant, and we were very pleased to see that there were resources that were made available through this specifically for the opiate epidemic. SAMHSA, within 24 or 48 hours of the President signing the bill, actually brought forth the guidance for states so that we would be able to hopefully connect resources with need as quickly as possible all across the country. The grants are going to be awarded on a formula based on unmet need for what I'll be calling through this presentation, opioid use disorder. Ohio, the $26 million of the $500 million for Ohio represents about 5.2% of the overall national award. That is a maximum amount, and so if we write a grant that is deemed to be terrible, we will not have access to all of those dollars. So obviously we want to do a high-quality job in requesting the resources. Our application is due on February 17th, which is a very quick turnaround. We do not have to provide any match from state sources, and we don't have any cost sharing. So this is basically a one-time, up to 2-year award to make progress. The single state agencies are designated by SAMHSA. Our department is the single state agency for Ohio, and so we are the only applicant that can move forward and request these funds for our state. And as I noted, the funding period is up to 2 years. The feds have told us that they hope to have resources to the states with, approved applications toward the end of May, and then we would want to push that out immediately once we receive the award. And so, in case you're wondering about time frame, that's what we've heard so far. The purpose is really, threefold: to increase access to treatment and reduce deaths. So, just do more of what it is that states have been seeking to do, and in some cases may have gap areas of which they're aware, and they've been unable to connect any resources for a topical area. Supplement activities or enhance activities that are already underway, and to really try to build out more of a comprehensive response to the opioid epidemic. And I think, as I've said in the past, and the governor said earlier this week at the press conference for Senate Bill 319, Ohio has a very robust and multifaceted response. I think more so than some other states, which is a positive thing, but obviously we certainly have a lot that we could do with these resources. The next couple of slides talk about SAMHSA expectations, and this is sort of the broad framework. I just wanted to provide some context here. The expectation is that states provide a broad array of prevention, treatment, recovery support services based on identified needs. They do not want the state to spend any more than 5% of the award on administrative costs or infrastructure costs in order to administer this grant. For Ohio, that would be about $1.3 million. And standing here, I can promise you that we will not be spending $1.3 million on infrastructure related to this grant. It's an up to amount. but that's part of the parameters that have been put forth. Treatment has to be at least 80% of the remaining amount, which represents about $19.8 million, and up to 20%, and this doesn't say this on the slide, but up to 20% is available for prevention, and that is about $4.9 million. So I think we're excited about the ability to infuse for both prevention and treatment across the state. Obviously, they want to see service coordination so that we do not have efforts underway in silos. That doesn't really help to make as much progress as would be the case with a coordinated response. And they also focus on the use of evidence-based practices when available, promising practices when the evidence base is not available for some reason. So they also want to the states to conduct needs assessments to identify really where the work needs to occur, both with these dollars and in the future for the planning of that state. And you can see here on the slide, identify areas where the opioid epidemic is most prevalent, the number of providers, how does access work in the state and where are the gaps. And as you're all aware, we have work underway on a number of fronts that actually inform us. We already have some existing data. And so, a needs assessment will not be something over the course of this grant period that will need to be built from scratch. I think we've got a lot of sources upon which we will draw, and we will be engaging you all in those activities as well. And then the expectation of SAMHSA also is that the state have a comprehensive strategic plan to address gaps, both with these dollars and into the future. And again, this is not a huge stretch for us because we already have a pretty strong foundation underway, understanding where and in what topical areas we have gaps. I want to note on this slide that these are not the first things that need to happen with these grant dollars either. So we can direct dollars for prevention and treatment, and we can work on this during the course of the grant period. So, we will not be holding up access to resources that can be used to actually connect people with prevention and treatment services and recovery supports while we're trying to, conduct a needs assessment. Wanted to make sure I mentioned that. SAMHSA's expectations, and I believe this is the last slide in this area, is to provide assistance to people who are trying to access treatment and have barriers. And also focusing on individuals who are re-entering from the criminal justice system or other sorts of rehabilitative settings, making sure that the continuum of care is one that is seamless for individuals as they're stepping through different levels. And then also, SAMHSA expects that we support or increase the use of peers and other sorts of recovery support services to the extent that we recognize as a state that we have gaps in different areas. I want to switch now to some of the allowable activities, and I want to use the analogy maybe of a fence or something. This kind of captures what we can do. It doesn't say that we have to do every single one of these items with the state's grant award. But allowable activities include training on best practices in a wide variety of areas, overdose prevention, training, pain management, etc. The second area is supporting access to connect with services to treat substance use disorders. So opioid treatment programs are mentioned specifically, but it is not exclusively access to the OTPs. Allowable activities also include addressing barriers to receiving treatment by reducing the cost of treatment. And again, states are in different places with respect to whether a state has expanded Medicaid or what kind of access barriers may exist. And so this is relatively broad, but it deals with access to care generally. And then there is also an allowable activity to train opioid use disorder prevention and treatment providers on CDC prescribing guidelines, overdose prevention, etc. Allowable activities include innovative telehealth strategies, and I know that in some places in Ohio, we have some of this underway. That would be an allowable activity. The integration of health information technology in support of an individual's ability to work with a series of providers as they begin their recovery journey and continue in their recovery. The purchase of naloxone is another allowable activity. I know that in some states they have not been as aggressive as we have in trying to connect people with this life-saving measure. So there's an opportunity here as well. And again, states will elect to avail themselves of different kind of opportunities depending on what their specific circumstance is. Prescription drug monitoring programs are another allowable activity. We do a lot of work with the Board of Pharmacy, which is our Ohio administrator of our PDMP, known as ORS. That's an allowable activity. Establish the network of systems, and recovery supports are very important as an adjunct to treatment services. And so again, states have different sorts of gaps, and there is, I think, quite a bit of agility in how a state could approach addressing those gaps with these resources. I want to switch over now and talk a little bit about data collection and performance measurements. SAMHSA is going to monitor our progress in a variety of ways. Every block grant submission, we have a plethora of reporting requirements, and some of what is submitted as part of that grant application will be applied to their ability to track how we're doing with these specific dollars. Nothing on here is very shocking. The number of people who receive treatment, recovery services, the number of providers who are helping to connect people with medication-assisted treatment, number of folks trained, rates of overdose-related deaths, and opioid use to the extent that that's available. So these are all things, again, that we can draw upon existing data sets in many cases to use as a benchmark going forward. And as we're working to build our plan and our needs assessment, we've got a lot of resources that we have at our disposal. Along with the measures specifically, we will need to submit an annual report at the end of this year, I'm assuming this federal fiscal year, and then next federal fiscal year, to just provide narrative of how we use the funds and what happened when we applied those funds to our gap areas. Specific grantees of the state of Ohio through this process will also be requested to submit progress reports, and obviously once we have a specific plan of action, there will be much more specificity in this regard. So thinking about the application requirements now, states are asked to identify geographically where we want to focus, and in which area we would like to focus demographically, if that is something that is relevant to that aspect of the proposal. Talk about where we are today, what the gap is, what we hope to achieve, and describe the nature of the challenge that we're trying to address. Again, this is very consistent with general grant application expectations, and so I think we've got a lot of work to do to pull this together, but I think that it is consistent with what is typically the kinds of information that's typically requested in a grant application. We also have to describe what our interventions are going to be and how we are identifying the focus of those interventions. So this will vary depending on whether it is patient-oriented or workforce-oriented, or so more to come on that. But I think they just want us to be comprehensive in our explanation of how we're planning to use the resources. And then we need to do some estimates of the number of individuals who will connect with treatment, recovery support, prevention, et cetera, with the use of these grant dollars. Again, nothing that is maybe unexpected in this case. So with those very broad areas of allowable use, we have had some discussion in the last 2 weeks on what our areas of focus logically would be. And the list on this sheet itemizes those. These will not be surprising to anyone who has interacted with the department in recent months. We just completed a round of community tours with the governor's office and some of the other cabinet agencies that are working very actively on the opiate epidemic, and access to medication-assisted treatment was one theme that was very consistent across all of our visits. In some cases, it is a challenge of workforce. In other cases, it's a challenge of trying to establish opportunities to get an MAT program going. But MAT thematically is, I think, a very consistent concern all across the state. So we thought that that would be a very logical area of focus. Prevention, obviously, is a named area, and it is really the ultimate way to eliminate downstream and continued challenges with addiction if people do not initiate use. And so we really want to put a focus on primary prevention and how we can, with these time-limited dollars, augment our community-based prevention efforts in the state. SBIRT, many of you may be aware that we actually have a federal grant, $5 million over 5 years for screening, brief intervention, and referral to treatment, and we have actually exceeded the expectations related to training for that grant and provider engagement, and we want to build on that because it has been very well received, and I think there's opportunity to enhance the integration between primary care, OBGYN, and our treatment community. And so that's another area where we would like to place some emphasis. Recovery supports, obviously with the Medicaid expansion 2 years ago, Ohio has really leveraged the opportunity to build out recovery supports in some exciting and I think really significant ways. And we want to continue to support that progress in areas where we recognize that we continue to have some gaps in our state. Workforce development is a key driver, not only as it relates to medication-assisted treatment, but just access to treatment services in general. And we know with the Medicaid redesign that is also underway, workforce has been a topic of discussion. And so we see great opportunity, again, with these time-limited dollars to make an infusion that hopefully could help augment and expand the workforce that over time then could build on, with more sustainability through the regular payment channels. And then also, this was not an area that was specifically delineated in the federal scope for this grant, but I think this is something that could be threaded through very easily, and it is a topic that we have heard very consistently in recent months, and that is the needs of individuals with vicarious trauma among first responders and treatment providers, in some cases child welfare workers and others related to the opiate epidemic. And so we want to use the survey, about which I'll speak in a moment, to get some feedback, some constructive, specific suggestions about how we might be able to incorporate this as an area of focus as well, because I think it's directly related to our ability to accomplish all the other bullet points on this list here. So when we get to the question period, I would be interested to hear if there are other themes that you feel that we have missed, but thinking about these as being time-limited opportunities for resources. And I think this is an opportunity to infuse where we know that we want to help establish something that can be sustained when these dollars go away. And these areas seemed like very practical and actionable areas for that sort of focus. So give some reflection to that as I continue the presentation here. What we would like you to do, we have a survey, and you can click the link here and complete it. it follows the themes that are listed on the previous slide, and we ask for areas that you would prioritize in terms of connecting with individuals in the community, and also, what specific, actionable things do you suggest related to these funds? We have been just deluged with calls about people who want to meet with us about specific ideas, and candidly, we just cannot make time in the schedule to meet with everyone who has been calling. And so we thought if we stood up a survey as a point of some triage, that would be very helpful. So we sent this out to our listserv that we send our e-update and our news now, which has more than 7,000 folks on it. We've started to get some feedback already, but given that you are statewide organizations, in large part, we thought that you might be willing to share the survey more broadly among your members. That would help, I think, number one, represent the organizations that you all represent, but number two, help to generate some additional constructive ideas. We are going to be providing updates through the next 6 weeks through our listserv. So if you are not subscribed, you can do that on the front page of our website. And as I noted, we don't have we don't have the ability to meet with everyone who's requesting to meet. But if you have specific questions that perhaps we could answer, Nicole Marks is the person within our office who is going to be receiving those questions and triaging those questions to connect you with a response. Specific next steps, we will be compiling the results of the survey and through the middle of this month. I think the survey is open till next Friday, till next Monday. So we have a pretty quick turnaround. We will compile the information and apply ideas from the survey, as well as just from other ideas that we have heard from the organizations on this call and others, to develop a draft that we will be working with the governor's office and others to to vet and to build out. And then we will submit the application approximately a month later, in the middle of February. Don't know yet how long it will take for the feds to turn all of this around and affirm state-specific amounts. Usually there's some degree of back and forth. If they want additional detail, of course, we will be happy to provide that. Can't really say when we will get our final grant award announcement, but when we do, I'm sure we will be letting you all know. So at this point, this sort of concludes the formal overview. If you have questions, please enter them into the chat box, and I'll go through and read them aloud. We are going to put this webinar online so that folks can review it after the fact. And then also we're going to create an FAQ document based on the questions that we received. And I'm sure we will be receiving questions, via Nicole or via the survey, subsequent, and we can provide updates there as well. So at this point, we don't have any questions, not yet. We'll just pause a moment in case anyone has questions. What we really wanted to do today is just make sure everybody was on the same page. I know some organizations on this call follow what's happening with our department much more closely than other organizations, and we just wanted to make sure that everyone was aware of this. And if you want to share a link to the survey with your members, that would be very much appreciated. All right, I'm still not seeing any questions, so I will, at this point, just say thank you, and thank you in advance for sharing the survey with others or responding to the survey yourself. Have a great weekend.